We have diagnosed that we have got hernia. Next, what is the treatment? Is there any medicine that can treat hernia? The answer is absolutely no. Hernia is nothing but a puncture of the abdominal wall or the muscle, so it has to be patched with a mechanical fixation called as a mesh. What is this mesh and what is it made up of? Mesh is nothing but we just approximate the muscle with the stitches. These stitches may give away whenever the patient exerts some pressure over the abdomen. That's why to prevent this hernia from happening again and again, we have diagnosed that we have got hernia. Next, what is the treatment? Is there any medicine that can treat hernia? The answer is absolutely no. Hernia is per se a mechanical problem. Like if there is a puncture to the tire, we have to seal that puncture with a patch, otherwise it won't get treated. In the same way, hernia is nothing but a puncture of the abdominal wall or the muscle, so it has to be patched with a mechanical fixation called as a mesh. What is this mesh and what is it made up of? Mesh is nothing but a structure which appears like a mosquito net, and depending upon the make or composition, it is generally made up of polypropylene. And this mesh, what exactly it does and what is the purpose of this mesh? As said, there is already a weakened abdominal wall muscle through which this hernia has happened. If the same weakened muscle is approximated with the stitches, these stitches may not hold for long duration. Post-surgery, if the gap in the muscle is closed with stitches alone without a mesh, and if the same patient gains weight, like suppose if a person is weighing 80 kgs and now he has gone to a tailor and this is the shirt which he has made. For the initial period, this shirt is loose and comfortable and we are able to do all the activities with ease. But if the same person has grown from 80 kgs to 120 kgs and if he wears the same shirt and if he does this activity, what might happen? The buttons may tear away. So in the same way, we just approximate the muscle with the stitches. These stitches may give away whenever the patient exerts some pressure over the abdomen. That's why to prevent this hernia from happening again and again, in every hernia surgery, what we'll be doing is we'll be reinforcing or strengthening the weakened abdominal wall muscle with a prosthetic material called as a mesh, so that there won't be any hernia happening again and again. Okay, I understood that mesh repair is needed in a hernia. Sort of treatment can we opt for? Whether to go for laparoscopy or whether to go for open surgery? The answer is always to go for laparoscopic surgery or keyhole surgery to have all the advantages of this minimal access surgery. So let's discuss about what happens in an open surgery and what happens in a laparoscopic surgery. What we do in an open surgery is we give a major or a large cut over the hernia part and we'll be separating all the tissues separately, and we'll be pushing back the protruded contents from inside, and we'll be sealing the hole in the muscle and we'll be reinforcing the weakened muscle with a mesh. So what is the end result of an open surgery? We'll be having a large incision. Because there is a large incision, the amount of pain or the amount of blood loss will be significant following an open surgery. And to close such a large wound, we need to place stitches, and after getting discharged also, patient need to have frequent dressings so that the wound get infected. If we compare it with a laparoscopic surgery or a keyhole surgery is completely different from an open surgery where we use complete use of the technology. How this technology is being employed in a laparoscopic surgery is we will be making a small holes in the abdomen ranging from 0.5 to 1 centimeter, and through these small holes we'll be inserting a camera inside the abdomen to know what is happening inside, and this camera will be connected to a video monitor through which we will be seeing everything in the monitor to see what is happening inside. So one hole will be for the camera and the rest 0.5 centimeter or half centimeter hole will be replica of right and left hand, through which we'll be inserting a small, slender, lean and thin laparoscopic instruments, and through these instruments we'll be able to catch, pull, cut, etc. and all. So the entire surgery will be completed by 3 holes, one for the camera and the rest 0.25 centimeters for the working port. So what is the end result? The size of the incision is very small. So because the size of the incision is small, likewise will be the amount of pain after surgery and less will be the blood loss during the surgery. And cosmetically also, this laparoscopic surgery gives the best result, and there won't be any need for prolonged bed rest, and there won't be any need to take long rest from the work and all. The return to activity will be much faster in laparoscopy compared to the open surgery. But the flip side of laparoscopic surgery is it is bit expensive or costly compared to open surgery, because a lot of technology like 4K monitor and these laparoscopic instruments are involved in a laparoscopic surgery. But we do have all the benefits of laparoscopic surgery compared to an open surgery, although it is costly. If you are having a bulge, or if you have noticed a swelling over the abdomen, and if you are still doubtful whether you have got a hernia or not, so please do feel free to contact in the below mentioned numbers. Myself, Dr. Abhilash, consultant laparoscopic surgeon from Hyderabad. Thank you.